I appreciate you doing this. I see the Tiger Woods injuries and they just seem devastating. When you see what has happened to him, what jumps out to you?
I mean, the thing that jumps out the most is that he's had so many major injuries in his career and he's bounced back every time. But the question is this sort of the last straw? Um, Two major injuries to one leg. I think it's pretty tough this late in his career to work back from, but he surprised us before.
When you talk about specifically what happened, there were some compound fractures, right? They're referring to them as open fractures, more than one. I mean, we all watched what happened with Alex Smith and how long it took him to get back and the mountains he had to climb going through 17 surgeries, an infection, a near amputation. I mean, that's an extreme case, but how realistic is something like that for someone like Tiger?
So it's interesting. The injuries themselves are sort of less the issue. It's more what can happen after the injury. Like you just alluded to, compartment pressures can go up, and that can lead to damage to muscles, nerves, and that's why those compartments were released in the operating room. Anytime you have an open fracture, there's always a risk of infection and then just getting wounds to heal, especially around the ankle, because he doesn't just have fractures in the leg, it's also in the ankle. Those all can sort of have complications. And just if everything goes perfectly, with just one of those injuries, the recovery can be a year. So this is going to be, a pretty steep climb for him.
I hear words that are scary like a crush injury in his ankle. When you have a crush injury, which to me, first thing that comes to mind is like, wow, that introduces bone fragments into this situation. And you got to be careful about that. Talk to me about what you know regarding a crush injury and what people deal with in those circumstances.
The crush injury, the biggest problem actually that we see is that compartment syndrome. So you saw in the statement that he released on Twitter that he had compartment releases where they go in and they actually made incisions in the fascia, which is the covering of all the muscles around his shin and his calf, so that when that swelling happens, because when you have a crush, you have a lot of swelling. When that happens, the pressure doesn't build up and then lead to death of muscle and tissue around it. So it's like less really bone fragments and it's more swelling in the lower leg that becomes the problem.
And when you're putting in screws and pins, what are the main concerns?
Well, again, it's really the injury. We deal in a world of rods and screws and pins. It's like construction, but it's more the injury that's the problem. It's more the healing, and hoping that that hardware does its job and allows the bone around it to heal in the long run, which is just going to take quite some time.
I mean, I've already mentioned Alex Smith. Is it proper to compare an injury like this to an injury like that?
It is. Alex Smith unfortunately had so many complications that are pretty common with that kind of injury. But remember, Alex Smith only had one of the injuries that Tiger Woods is dealing with. He had that upper, leg injury or upper lower leg injury where the tibia and the fibula both broke. This is a problem in Tiger Woods where he has that high in those two bones, but then he has it down in the ankle too. So it's Alex Smith's injury, but then adding an ankle injury on top of that.
What would be your main words of wisdom to a patient who is about to embark on a rehab from injuries like this?
I mean, for me to give advice to Tiger Woods on something like that is ridiculous after what we saw him do in the past couple of years. But, I think he's got the fight in him. I will not be surprised to see him, leave the hospital in a red golf shirt, ready to take on his recovery. But I'm just staying with it and really listening to what his doctors and his rehab specialists recommend.
Well, take Tiger out of it. Any patient, what would be the main steps or levels of concern they should have in the days and weeks ahead?
Yeah, it's mostly about swelling, keeping swelling down, elevating the leg, and again, listening to what the doctors say, going into all your follow up appointments, and making sure that all the muscles and the tissue that needs to heal is doing the right thing, and really monitoring closely for any of the complications that we've seen in professional athletes like Alex Smith.
Good stuff. Dr. Jessica Flynn, we appreciate the time and the insight. Thanks very much.
Thanks for having me.